Yesterday we have seen abdomen up to a certain level. Now we will proceed for the next.
Yeah.
I think we have finished page number 27.
Yeah.
Screen clear for both of you.
Yeah. For me, it's clear.
Okay, Sanjita, I hope you are not sleeping. Don't sleep. Okay. Okay. So we have seen this topic, Litters hernia, when it contains Meckel's diverticulum.
Yeah.
Richter's hernia, when they contain only one side of the bowel. This is very, very important, and it is a repeated
Only one side.
question. Yeah, only one side. Only one side. Okay. And then epigastric Richter's incisional Spigelian. This is also very, very important, repeated. Through the linea semilunaris. Hernia through the linea semilunaris. Okay. And urgent need to repair because risk of strangulation. If it is strangulated, then we have to cut the section as like here. If it is strangulated, we have to dissect the section and then we have to do end-to-end anastomosis if it is viable both sides, or we have to make a stoma. We have to make a stoma here and another stoma here, and then it will be again two set of surgery. Okay, we have seen difference between gastroparesis and compilocele. Now, scrotal and testicular anatomy. If we remember the anterior abdominal wall muscle, then it will be easy. Okay, first we will see the origin. External oblique aponeurosis. Just remember external oblique aponeurosis. It was the first layer, right? External oblique aponeurosis, like this picture. This is external oblique muscle, and when they are coming in the center, it is becoming aponeurosis. Then we have second layer, internal oblique muscle, and medially aponeurosis. Then transversus abdominis muscle, medially their aponeurosis. Actually, see, internal oblique and transversus abdominis muscle, they reach, when they reach medially, they fuse together, they join together. Okay, both of them, they join together, and they makes a important structure in inguinal canal. Do you remember which structure they form both together? Internal oblique muscle and transversus abdominis muscle. Very good. Roof of the inguinal canal. Now we have seen that when what is the content of inguinal canal in case of male?
Spermatic cord and uterine wall.
Yes, spermatic cord has its three layers, right?
Yeah.
Can you remember the name?
External spermatic fascia, peristaric fascia, and internal spermatic fascia.
Excellent. Exactly this one we will read here. External spermatic fascia, it is coming from external oblique aponeurosis. Then premisteric fascia, it is coming from internal oblique, just the second layer. And their internal spermatic fascia, it is coming from the transversalis fascia. A little difference here. External oblique, internal oblique, then this one should be transversus abdominis, right? This one should be transversus abdominis, but here is the difference. Here, instead of transversus abdominis, will come the next layer, and next layer is transversalis fascia. Okay. Now content of the cord. Content of the cord, vas deferens, testicular artery. This structure just you need to read. In some question they might give which of the following structure is not a content of the cord. Okay, so what does the cord carry? Testicular artery, artery of the vas deferens, and premisteric artery. So we got three arteries. One is testicular artery, artery of vas deferens, and premisteric artery. Okay. Then pampiniform plexus. This is actually a venous plexus. Pampiniform plexus. You might have heard the name of varicocele. varicocele. Yeah, varicocele. This is just the engorgement of this pampiniform plexus of vein. Then we have nerve, sympathetic nerve fiber, then genital branch of the genitofemoral nerve. It feels good to say this branch. Genital branch of the genitofemoral branch nerve, and lymphatic vessel. Lymphatic vessel. So, what are the content? We have 3 artery. We have 1 vein. Then we have 2 nerve and lymph. Lymph node. Will you repeat anyone? 3 artery.
Testicular artery, three artery, testicular artery, artery of vas deferens, hemisteric artery, and nerve, 2 nerve, pampiniform plexus, vein pampiniform plexus, and 2 nerve, sympathetic nerve fiber, and genital branch of the genitofemoral nerve, and 1 lymphatic drainage, lymphatic vessels.
Yeah, lymphatic vessel. Now, scrotum. Composed of the skin and closely attached dartos fascia. Very important, dartos fascia. One will be dartos muscle. Dartos muscle and dartos fascia. Two are different. In the scrotum, we have dartos fascia. Okay. Arterial supply from the anterior and posterior scrotal artery. Lymphatic drainage to the inguinal lymph node, and parietal layer of the tunica vaginalis is the innermost layer. We will see the layer of the scrotum. Again you can see here. And muscle. Dartos fascia and muscle. Then external spermatic fascia, the same sequence. External spermatic fascia, the mysteric fascia, internal spermatic fascia. Tunica vaginalis and testis. Just remember, when we studied the content of the inguinal canal, we have seen here spermatic cord. So in spermatic cord, we have seen there will be 3 layers, covered by 3 layers. And before this 3 layer, simple 2 structure. One is skin, another one is dartos muscle and fascia. Simple, right? Skin, dartos fascia and muscle, then those 3
layers. Yeah.
external spermatic fascia, mysteric fascia, internal spermatic fascia. After that, tunica vaginalis and the innermost layer, testis. So testis is covered by tunica vaginalis. If they ask question like this, testis is covered by tunica vaginalis. Okay. Now sometimes they ask about the which layer arise from where. Okay. Layers of the anterior ventral wall. You can just have a look of this one. Just read this part. I have a question. Finished and continue. Yes,
ঠান্ডা লেপন বেশি এত হেঁচিয়া হয়ে
Can you hear me?
Yeah.
Yes.
Okay. See here some important incision. Just you need to know about McBurney's point lacerated stitches. Okay. These are not that much important. Just you can have a look about the name.
McBurney's point, yeah.
Yeah. This part is important. Okay. This part is important. This is laser momentum. Here. Laser momentum. This is actually a cover. Whole peritoneal just remember this one. There is a common, this is anterior fold. Okay, anterior. Inferior aspect of the diaphragm, superior aspect of the liver, then inferior aspect of the liver, then comes the stomach, and they are making like the anterior fold, or this is called greater sac. This is greater sac. And the posteriorly we have laser sac. Okay, posteriorly we have laser sac, and these two sac is connected together with a foramen. It is called omental foramen or epiploic foramen. Omental foramen or epiploic foramen. You can see here, just inferior aspect of the liver and superior aspect of the stomach. This is the important landmark for any hepatobiliary surgeon. Why? While doing any hepatic surgery, if unexpected something happened and huge bleeding started, then they use this port to hold the vessel directly with the finger. Okay, this is called Fingal's maneuver. With this Fingal's maneuver, they can directly occlude the vessels. Again, epiploic foramen or omental foramen. It is also called foramen of Winslow. Boundary anteriorly, very important. This is exam question. From here you will get 1 mark. Anteriorly, bile duct to the right side. Here there will be total triad, hepatic artery, bile duct, and portal vein.
Very brilliant. Yeah.
Yes. Yes. Here is hepatic artery, then portal vein and common bile duct. So anteriorly, in the right side we have bile duct. Right side we have bile duct. Behind we have portal vein, and in the left side hepatic artery. So if this is the epiploic foramen, this is left side, this is right side, and this is behind. Behind we have portal vein, PV. Behind PV, portal vein. Left side we have hepatic artery, and right side we have bile duct. Then posteriorly we have inferior vena cava, superiorly we have caudate lobe of the liver, and inferiorly first part of the duodenum. Sorry, I have to go. Okay, so this is your exam question. Both of you, now you can start this exam question. I will keep the question in a scroll format. You can see and you can answer, or you can answer from that page also.
Yeah.
Once I'm back, then I will continue this question.
Okay, thank you.
Yeah.
Thank you.
পেশেন্টের নাম অথবা আইডি। না না, পেশেন্টের জন্য। It is done, Dr. Zania. For you, it is done. You finished? Hello, am I audible?
Finished.
और 3 दिन बाद यहाँ पर अनबा ड्रेसिंग पलटा मिलता है। फिर बाद हम लोग प्रिय दिन को 3 दिन चलाए करते हैं। काउंटर बना तरह कोई। हाँ, फिर से करें।
জ্বর ছিল ছাড়ছিল জ্বর কমে গেছে কিন্তু হালকা বুকে ভিতরে ব্যথা।
বুকে ব্যথা কোন পাশে? জ্বরটা এখন আর নাই।
অনেক দুর্বল স্যালাইনের ছিল
তারপরে আর বড় ভিতরে ইনফেকশন আছে।
You'll get this fresh.
ভিডিওটা দেখেন, এখানে কি বলা এটা ফলো করবেন। আর আমি যত করছি ওটা ঠিক আছে।
গলার ভিতরে অনেক ইনফেকশন হয়েছে আর এই ইনফেকশনের কারণে আপনার শরীরে জ্বর আসছে এবং পুরো শরীরে ব্যথা করছে। তাই আপনাকে আমি একটা মাউথ ওয়াশ লিখে দিচ্ছি। এটা আধা গ্লাস কুসুম গরম পানিতে 3 থেকে 4 ml মেডিসিন দিবেন। তারপর পানিটা মুখে নিয়ে এরকম গড়গড় করে বাইরে ফেলবেন। পুরো আধা গ্লাস পানি আপনি গড়গড় করে শেষ করবেন। এভাবে করে সকালে একবার 5 মিনিট, দুপুরে 5 মিনিট এবং রাতে 5 মিনিট, কমপক্ষে 3 বার দিনে করবেন 1 সপ্তাহ নাগাদ। রাতে ঘুমানোর সময় অথবা যখন আপনি দূরে থাকেন অথবা এসি গাড়িতে বসেন অথবা যদি বাহারের তাপমাত্রা কম থাকে তাহলে গলায় অবশ্যই আপনি একটি মাফলার বড় পেঁচিয়ে রাখবেন যাতে করে ঠান্ডা বাতাস গলায় না লাগে।
নাম কি আপনার? বয়স? এই ওষুধগুলো ব্যবহার করেন, ঠিক হয়ে যাবে। ঠিক আছে। মূলত এইখানে যে অ্যান্টিবায়োটিক আছে এটাতে অনেক অ্যাসিডিটি হয়, এটা হচ্ছে অ্যাসিডিটির কারণে আমি দেখে দিচ্ছি এগুলো ব্যবহার করে কমে যাবে। ঠিক আছে, আর যদি আপনার শরীর বেশি দুর্বলতা লাগে তাহলে আপনি প্রয়োজনে আবার স্যালাইন নিতে পারেন, কিন্তু এটা বাধ্যতামূলক। এই ওষুধগুলো মুখেই কমে যাবে। ঠিক আছে। হ্যালো, hello, you can hear me, both of you? Hello, can you hear me? Okay, you finished the exam? Okay, we will continue. Okay, so we will continue now. Okay. Yeah, we will be discussing about the epiploic foramen or omental foramen. Epiploic foramen boundary we have seen, and why it is important. You can see here. During liver surgery, bleeding may be controlled by using Fingal's maneuver. So this is that foramen of Winslow or epiploic foramen. When there is any active bleeding from either hepatic artery or portal vein, then surgeon can put their finger through this and can occlude the vessels with the thumb and the index finger. It allows them some time to control bleeding. Here you can see the picture. This is that epiploic foramen. Okay. Now abdominal aorta branches. Just can read the branches. Anyone of you can discuss. I will keep mute again, patient, but you can discuss, and then I will again continue. Okay. Permission sense? ये टेस्ट आपको कराना है? ठीक है, ये करा सकते हैं, मैं लिख कर देता हूँ, पर ये टेस्ट आपको उधर सेंटर में जाकर कराना है। ठीक है, हाँ ठीक है, वो काउंटर से आपको पता है, आप उधर दिखेंगे वो इधर इधर काउंटर